So most people are told to manage chronic conditions with lifelong meds. But what if that's not the only way? This episode reveals how five people, some of our wellness heroes, went from managing to healing by rethinking what true recovery really takes. For millions living with chronic illness, the default path is management, medication, maintenance, and acceptance. But today we explore something radically hopeful, stories of people who challenged that path and found something more. In this episode, we will share what these wellness heroes did differently, how they identified and addressed the true root causes, and why medication, while sometimes necessary, is not always the final answer. We will also look at best practices for medication use, what long-term really means, and what is often missing from chronic care conversations. If you ever wondered whether there's a better way to support your body, your brain, and your health than just managing symptoms, this conversation is for you. Welcome to WellWaveNOW, your portal for actual wellness insight. We, Breck Rice, Dr. Bob Levine, and I, Tim Daniels, are your wellness catalysts, committed to elevating your health, enhancing your functionality, and optimizing your performance at every life stage. We're WellWaveNOW, where time is wisdom lights your wellness path.
So it's great to be with you again, Tim, Dr. Bob. Always great. I learn something from you every time we get together. So let's start at the beginning, looking at what happens when someone refuses to accept that they're going to have to be on a medication for life, right? And they decide that there has got to be another way. And let's dive into some of these stories of some of our wellness heroes. So let me put up air quotes here for those watching on YouTube, and I'll just say quote for those that are listening to the replay on the podcast. But quote: "I was told I would be on meds for life, but I knew that there had to be a deeper reason my body was in distress." From Lori Levine. That is the season 2, episode 20. Quote: "They said meds were the only way. I said, no, I refuse to accept this." And that is Divya, is it Dawn? Dawan?
Yep.
That's season 2, episode 25. And I encourage all of our listeners, of course, to go back and listen to those episodes. So these wellness heroes just refused to accept that they were going to have to be on long-term medications. Dr. Bob.
Yeah, I just want to put this out here as we dive into this. Every time I've lectured anybody, physicians or lay personnel, whatever, I always say there's never been a drug invented that addresses the underlying source of an illness. That means that they're all band-aids to a certain extent. Some are very good, some are quite needed in emergency situations, and others are definitely not so good and have a lot of side effects. But when we look at how pharmaceuticals, and I've never had a medical practitioner, anybody disagree with me, because the medicine can help, but it's not addressing the underlying source, like what caused the illness to appear in the first place. So I just want to put that out there for everybody to think about.
Yeah, now, Dr. Bob, you've had Tim Daniels disagree with you on that one, on one point, but only in one category. So there are other things. So hormones, for example, people often talk about. Those don't really address the underlying cause, because they don't talk to why the gland failed in the first place. So agree with you on the hormones. Where I potentially disagree is in the area of vaccines. Now, there's a lot of controversy around.
Oh my God, we can't even go there.
taking some vaccines, but that's about content and side effects. But if you take a vaccine, what it's supposed to do, supposed to prevent that virus from entering the body. So in that case, addresses the source. So that's the only area where I would debate with you, Bob. I don't want to get a debate about you should take them or not. but if you do take them, that's the one area. But aside from that, 100% agree. So 99.5% agree with you, Doctor.
We'll have Secretary Kennedy on for that discussion.
I was going to say, Tim, you and I'll have this one offline, but it's good that we agree on. It's obvious. I mean, for the most part, I always tell people, if you're on long-term pharmaceuticals, you want to find a way to get off if you can. Work with your physicians and your pharmacists and pharmacologists to understand what you can do and can't do.
And I would agree with that too. And so do the wellness heroes that we just quoted, right? They had the courage to take a different path. Right. And that's what we're going to get into today.
Right. And that's, I think, is very, very key. I was just thinking about that as we were, discussing this and going through it. is that it takes some courage to challenge your doctor, and you really challenge them, question them, get them to look deeper with you on ways to address it. There are there may be times when you can't do that. If you're facing a life threatening decision, something very acute, then you just gotta go with them. But in the case if you got Lori Lundin had, I think she had ulcerative colitis, and so it's not something in her case that was going to kill her in day one. She step back and say, "There's got to be a better answer than just living on these medications for the rest of my life."
Yeah.
I think you got to have the mentality to do that. What's become apparent to me we've been doing this about a year and a half now. We've had on a number of wellness heroes and looked at things. And it's just what's become apparent to me now is doctors are very, very good, very, very well trained, very, very knowledgeable, but it's in a specific area. It's in diagnosing and it's in addressing either with medication or surgeries in 99% of the cases. What we've come to see is that there are so many other alternatives out there: exercise, lifestyle, physical therapy, herbs, breathing, parasympathetic healing. There's so many other things that can bring true healing that people need to be aware of and need to work their doctors to work that with them.
Yeah.
Just one more thing. So I want to make sure our listeners know that if they have a condition, something like high blood pressure that they're medicated for, uncontrolled high blood pressure. There's a lot of people on blood pressure meds that, even on the meds, they're not under very good control. They have to be careful, and their blood sugar is the same way. So,
Right.
so if you're going to try other things, which I highly recommend, to bring your body back into balance, so you don't need those meds, you got to monitor whatever those meds are doing. So if it's high blood pressure meds, you got to be monitoring your blood pressure. Because in some of the people I've been worked with, they had really high blood pressure, and they were uncontrolled even on the blood pressure meds. And as we got them back into control and de-stressed and everything else that went with the therapeutic protocol that I put together for them, they had to monitor their blood pressures because the blood pressure came down really fast. And one woman went to her doctor and said, "Hey, my blood pressure on the meds has been 150 over 100, which is out of control. And now they're 90 over 60. What are we going to do?" And they didn't adjust their medications, which is crazy.
Yeah.
Yeah.
So
Yeah.
just watch what's going on.
One thing that that we consistently found with all of our wellness heroes, right, in their stories is that, and I think this is important for our listeners here too, is that they rejected the idea that there was only one way. There was only one final answer, and it was a lifetime of medication. They began asking deeper questions. They started looking at the root cause, understanding, hey, yeah, the medication is working to treat a symptom, but what is the actual underlying root cause? And that came out in every one of these stories, that getting to where was that pain, inflammation, whatever the symptom was, where was it actually coming from?
Right. Yeah, like headaches, anxiety. Where's all that coming from?
Yeah. Explored the nervous system, healing the nervous system. And it wasn't just a physical treatment. They started looking at the whole body treatment, right? Gut health, vagus nerve, other, things than just the physical symptoms that they were feeling.
The mind, brain, body connection.
Yep.
So I think, Breck, as you went down there, you done some analysis and looked at the commonalities between five of the wellness heroes, and you went through a few of those there. So I think there are like 8 or 9 major ones, main commonalities. What are those? How would you list those out for the audience?
Yeah, I mean, listed that they looked at, asking more questions, right, of where this root cause was coming from, exploring the nervous systems, not being identified by their symptom, right? So the mindset in what they were doing, they took ownership for their own self-education too, lifestyle. There was some changes in every one of the wellness heroes. They made some adjustments to their lifestyle, movement, nutrition, emotions, and they used medications when helpful, but not a life sentence of medication. And turn their recovery into also a way to serve others, which I'm excited we're gonna get into that a little deeper.
Right. And I saw it, and I think the other things we'll explore that. The other thing they also did was they stopped identifying as just a sick person that says, I've got this, and you kind of alluded to that. They really said, reclaimed, who they were as people, their personal agency, and said, I can do something about this and move forward. But
Yep.
as you also said, turning that recovery into serving others is very key. So let's go a little deeper because it wasn't just just the mindset that I talked about there, reclaim the agency. It was and you talked about a little bit. It was the moment they started asking better questions of themselves that takes us to kind of what's next. And so here's some of the quotes of what that turning point to them was. We take McCall LeBaron, and she talked about I was doing everything right, supplements, clean food, even functional medicine, but I wasn't getting better. The real answer was in my nervous system. And then Carrie Macarini, who faced a lot of things, right? She had a traumatic brain injury. She had the Chiari, which was part of the brain extending through the skull. She had Lyme disease and other things going on. And she said what people needed wasn't another product. It was something fine. It was someone finally asking the right questions, that got her to where she needed to be on that. So it gets back to, there are, in my mind, kind of limitations to just staying with the symptoms, right? Getting back to Bob saying about the root cause. It's going beyond saying I just Bob and I talk about our knees quite a bit. So it's getting beyond saying, boy, my knees hurt. I wish I could just quit I could stop the pain in my knees. Or it's getting beyond just, boy, if I could just get rid of the stiffness a little bit, then I can move forward. It's looking at, well, what's causing this? What's driving this? And I'm going to divulge, I guess, from our wellness heroes a little bit and talk just briefly about myself on this one. Because recently, now I've only been on this, I've been trying to find things for my knees, as Dr. Bob and I have talked about for a long time. Tried these great little
Yeah,
patches.
you D1 athletes really destroyed your knees, that's for sure.
Yeah,
His
yeah,
hip, shoulders, you know.
and then was a
Yeah.
martial artist for a long time, after that for a while. But so I've tried topicals. I even tried using ibuprofen sporadically. I tried condrosin and chondroitin. I tried X, Y, Z, and D. Still hadn't got in there, but I was facing something coming up. I was going to have to go up and down a lot more stairs, and I said, I got to. It's either I'm going to have an operation or something's got to give here if I'm going to have to go up these stairs more often. And so I sat down a little bit with one of our other experts, Armand Ethelbacher, on supplementation. We started going back and forth. We talked about peptides first to regenerate. And I said, well, I don't want to try these two peptides because there's some theoretical dangers related to them in terms of cancer relating. One was supposed theoretically could cause tumor growth. Other one theoretically could cause cancer cells to proliferate and metastasize. So we started digging into supplementation. So then I added 4 new supplements, just supplements, just natural stuff.
And not wild things either, right? It wasn't like twigs and sticks and stuff. It was
no, it
common
was
supplements.
something called UC2, Undenatured Collagen 2, which is supposed to help the body stop attacking the collagen over time. It was boswellia, which was to do some things. Something called MSN, and one other one. Put that in the cycle. I noticed a change in one day, and it's been a little over 2 weeks now. The joint is extending more. The range of motion has improved. The tightness has gone down. The stamina of standing without pain has gone up. And I'm sitting there saying, well, I will say I've had doctors from the universe since I had these knees. It's operated on by a Stanford University medical school doctor and this thing afterwards. I've had a University of Chicago medical school people. I've had some of the best doctors on the East Coast on this. None of them ever told me about these simple supplements. I found them, great improvement. I'll keep you guys going, but that's answering the real questions. What's really getting at it? And so I work with ChatGPT and Armand on this. Is getting at inflammation. It's getting at the body attacking the cartilage, et cetera, et cetera. It's getting to the root causes of it and driving some improvement on it.
Yeah. Yeah, we see this a lot when people are doing everything right, but still, still not seeing the healing. You found a solution, but other people were still stuck in the medication as the solution. Dr. Bob?
Well, I just want to put something in about when we say doing everything right. Right according to who, what is the right thing? So maybe when we say doing everything right, maybe that relates to what conventional medicine is. Right.
Hmm.
And we already know that for most chronic conditions, conventional medicine it manages symptoms. It's managing conditions. It's not necessarily approaching the underlying source of the conditions. So that in itself is problematic. But the other thing I wanted to say was people get really attached to having a diagnosis. And that's, to me, that's dangerous. Like, I don't really want to deal with diagnoses as a practitioner. I deal with symptoms. What are your symptoms and what's underneath pushing out those symptoms? Because I can take somebody who's got a certain diagnosis and I'll treat them and I can get them completely free of symptoms. What happened to the diagnosis? Is it gone, or what's happening with that? So people seem like they have to know a diagnosis. I don't even want to know a diagnosis. I just want to know, what are my symptoms and what do I have to do to alleviate the underlying driver of the symptoms?
So a diagnosis wouldn't help. And I think they look at it. A number of them say, well, they say, I finally, the finally means is not in my, I think it was, one of my people, Perry Mancarini, and a couple others were told this is all in my head. I think when they get a diagnosis, it finally, then they say, hey, somebody's recognizing that it's not all in my head. But wouldn't doesn't the diagnosis kind of help you identify what the root cause is, Dr. Bob?
Well, if you came to me, Tim, with your knees, I know you got knee pain. Okay, so where is it? What's happening? But I don't need to know all the details of what is the diagnosis. If you got knee pain, you have shoulder pain, you have diverticulitis, means you got abdominal issues,
Mhm.
gastrointestinal issues. So, I mean, the diagnosis, I don't mind hearing it, but I
Mhm.
don't like to rely on it. And I think people, when they get a lot of diagnoses, as all of us know, are non-specific. I mean, you have arthritis. I mean, that's a great one for just throwing as a catch-all. Somebody's got, you know, somebody has pain somewhere. Oh, you have arthritic spines. Look at that. But then there's other people that have the same arthritic spines. They have zero pain.
Right.
Yeah.
So
Yeah.
Yeah.
I'm only talking about this so that our listeners can know that it's not so important to have a diagnosis as it is to be able to explain to practitioners what your symptoms are and how to get underneath those in a natural, drug-free way to see if those symptoms can be eliminated.
Yeah, and that's where I'd like to go next is discussing, medications versus, true results, right? And there's so many people stuck in, that this medication was prescribed, and so it must be, what I need to take to feel better, but is it also hiding the real issue? And I always end, all of my scary drug facts on TikTok with always saying that, hey, when the side effects outweigh the benefits, it's time to do something different. So that has a lot to do with it too. Medications do have side effects, so we need to understand that and address that too. But going back to our wellness heroes here, I want to quote again Divya from season 2, episode 25. The medications offered didn't heal me. They clouded the picture of what was really going on. Man, that statement is so true, right? It's masking the real underlying issue that was going on. Another quote from season 2, episode 10, Jeff Pearson. Doctors gave me meds for the symptoms, but no one helped me understand how to live beyond the label. You talked about that earlier, Tim. Living beyond the label. What again does that mean?
Well, it gets back to this to say that okay, I'm an arthritic. I'm a MS, multiple sclerosis person. So once you kind of accept that label, then you're almost accepting. It just ties a little bit in with Dr. Bob's thing on diagnosis. It ties a little. Once you accept that label, you're almost accepting that that's what I have to live with. And that's what, if you take a look at what Divya did, it gets back to that rejection is because then if you accept that, you're accepting, I'll take this medication, I'll manage these symptoms, I'll try to live optimally with the medication underneath that. What both she and what Jeff were saying was, no, I think I can get rid of this. I shouldn't have to live this way for decades. Let me work towards that answer. And this where and they were doing a number of things right. They were taking taking the medication to start with, but they were doing other things, lifestyle changes. But I think the other thing been consistent with these people is they didn't give up. Meaning, even if I take it to my knees, I've been doing I tried exercises with it. I tried weightlifting. I tried these things with it. I put PEMF on it, and PEMF did help in some regard. But then I said, this still isn't where I need it to be, and I got to try something else here. You add on to it, and that's what each one of them did. You take the other person, Victor Briere, I don't think we mentioned here, who's the Ayurveda person with us. He said, look, I'm doing all these things right. I'm going to add yoga, and yoga got him a little freedom from his back movements and from his back pain. Then he went on something else until he cleared it. So that's what it is. It's not accepting that label of this is who I am and defining it. But one thing I was going to point to Bob. All these people, I think we kind of glossed over one thing a little bit. We talked about nervous system, and the nervous system healing. I think that relates to some of the work that Bob does, in other words, and that mind-body connection is that you got to get in the right state for healing. So whatever you're going to comment on, Bob, work something in on that as well.
Yeah. Well, since I forgot what I was going to comment, I'll just talk about what you're asking now. But I always talk about, I don't talk about the mind-body connection anymore because everybody thinks that the mind and the brain are the same thing. And so I say it's the mind-brain body connection because the brain is this beautiful chemical, energetic organ that kind of runs the body. The parasympathetic nervous system is the automatic part of the nervous system that runs automatically, heart rate, breathing, etc. Then the sympathetic, which is you could say is the fight or flight component, but that's the sympathetic nervous system is more of the conscious mind system where whatever we're thinking and saying is likely to happen, and so we're communicating with everybody through our conscious mind. So to me, the mind is overarching, and the mind directs the brain what to do. Like if I say I can never remember anything, my memory is going. Guess what? That's what the brain is going to work on. It's like it's going to it's okay to forget. But when we say I can remember everything easily, I remember names, I remember phone numbers, it's perfect. Our mind and brain are going to work together. If I say I want to be pain free by the morning, I've had people, I tell them before they go to bed, just tell your brain, work it out. I want to be pain free by the morning. And I also give them things to do to support that. And then at some point, they're going to be pain free in the morning. It just depends if it's this morning or the next morning or the next morning. So that's where, as you guys have been talking about, people were determined to get the answer. And that's really important. You got to keep your mind open, because if your mind's not open, then you're going to get the same results forever, right? But when you open up your mind and you are willing to try different things, then things can happen that can work for you pretty well, especially when you run into the right guidance. So I don't know if that's helpful.
That's helpful. And I think we'll dive into that a little bit more. I kind of did a Dr. Bob and leaped ahead. I was so excited. I think I think there's some things like I'd like to lean on Breck a little bit more for, which is on the medication thing, related to it. These people said I'm not going to be on it for long term. So, Breck, in your world, as you look at that, what is considered long term, and are medications really meant to be used, or are they optimal for long term use?
Yeah, the side effects, the scary side effects multiply the longer that somebody is on a medication. The scary side effects multiply the number of medications that somebody is on. I learned from Dr. Bob about these controlled drug studies where you have healthy, virtually healthy patients trying out a new medication with no other medication. So just only that one medication. And so how does the chemistry change when you add 2 or 3 medications? And, I always think about our poor, seniors that are on 10, 12 medications. And, the first 1 or 2 medications are actually treating a symptom. But then medication 3 and 4 are treating the negative side effects of 1 and 2, and then 5 and 6 treating the side effects of 4 and 5. I mean, it continues to chain and chain and chain. So long term for me, I think there are exceptions. Tim, you and I discussed this off the air about there are some exceptions to the rule, but generally, I would say any medication was really intended for your short-term use. There's going to be some exceptions. So antipsychotics, for instance, really helping a lot of people stabilize their mood. But you brought up a really good point, Tim. What if there was a natural solution, just like for your knee?
Yeah.
Are there some natural products out there, lion's mane,
Yeah.
ashwagandha, that may also help stabilize somebody's mood?
Right. And there are they used to talk about bad things about electroshock therapy back in the 60s, but that's really come a long way. And I've had a friend of mine, bipolar, who went through the new type of ECT, and it brought some relief to him because it's finding that the body and the cells, there's just an amount of energy that they responds to energy in different ways as it does to medication. Sometimes that can get at the root cause. There's things that's repetitive transcranial magnetic stimulation, which sounds out of this world, but as I think Stanford has its own form of it, Harvard has a form, or the Mayo Clinic has a form for it, which has been shown to help with depression that wasn't responding to other types of approaches. So I think even in the world of the brain, which is just part of the body, there may be other alternatives to long-term medication. And again, my caveat, just as Bob put in earlier, is I certainly don't want anybody who's taking something for antipsychotic to drop it right away and run off, just like someone who's taking something because their blood pressure is out of control to drop and run off. But it should be explored with competent professionals as to, are there alternatives for this? Can we try some different things for this, and work through it with them and push
Yeah.
them. One other thing, because I found when I was doing some things with some physicians from Yale regarding myself last year, that the real top notch ones, they like to be pushed. They like to learn it, and so if you can get them in that mode, they'll work with you and work some things.
Yeah, yeah, absolutely. What I was going to state about, the long-term use, it really depends on the condition that is being treated. But again, I say that the majority of medications were really intended for short-term help or assistance. I'll use my own personal experience with, with a PPI, so a helping with acid reflux and GERD or heartburn, whatever you want to call it, right? That was an easy way out for me, and so I think the majority of patients taking the medication are looking for the easy way out when I can correct those symptoms that I was experienced through proper diet and exercise. And what was the long-term use, effect of taking a medication to block those acids from giving me heartburn? Robbed calcium from my bone, weakened my bones, blew out an ankle, had to put screws and pins and all kinds of crazy stuff in there to repair an ankle that could have been avoided with proper diet.
Sure.
Yeah. I think there are a couple of categories you mentioned there. One, there are people who just want a pill or a shot to fix things, because it now has become sort of accepted that diabetes can be controlled with some lifestyle changes, and even reversed in some cases, reversed with lifestyle changes. But some people don't want to go through those lifestyle changes. They say, just give me the insulin, give me the metformin, or give me the GLP to lose the weight.
Yeah.
So there's that category. But then there's the other category. Just when I was talking to another friend of mine yesterday, just said we were got in the discussion this morning, said, just got to trust the doctor. And when it gets back to our earlier statement, doctors are wonderful, doctors are good. I wouldn't go without one. If I try to find the best around, but a number of them are trained in medication. So it's, how do you help them and help yourself look outside of medication for an answer on some things.
Yeah. Yeah. We kind of touched on it, the polypharmacy risk, right?
Right.
And multiple medications. But should Western medicine expand their scope on just focusing on a chemical medication? Absolutely. And some really smart health systems are doing that very thing.
Right.
Tim, I think you brought up the example of, is it the Cleveland Clinic that is now integrating Chinese medicine into
No, that,
allopathic?
that was one of our guests. Well, that was one of our upcoming guests that did that,
Okay.
where she mentioned that one to us that they're doing. But yeah, but even if you go back to one of our other one of our early guests, a guy named Jeff Zimmerman. And there's an episode on him. He's really doing the breathing technique for veterans out with PTSD. But
Mhm.
he was brought in surgically to, I don't remember, one of the top New York systems, healthcare systems in the New York area, where his work on breathing and Chinese energy work, some heart surgeons were incorporating that into the operating room with him. So there are indeed some that are expanding that with him.
Yeah, yeah. I was visiting a neurology office in Texas, and they have a healer, so
Mhm.
a functional medicine healer, right in their,
Right.
their neurology. He's a neurosurgeon. He's created his own discs to replace bad discs
Mhm.
in the back. So he's used to doing surgery, right? Doing really allopathic approaches, but yet believes in having a holistic healer or holistic provider right there in his office.
Right.
I've got something for you really quick.
Well,
I'm very proud that I was, this is back in the early 2000s. We did an ACL, anterior cruciate ligament in the knee, reconstructive surgery on a patient without general or spinal anesthesia,
mm,
just
Wow.
using just using hypnosis and electroacupuncture, and that was it. And patient made it through perfectly. Was awake the whole time. They were talking. Oh, I can feel that. Oh, I felt that, but they didn't move a muscle. This is,
mm.
we got it on we got it on film, national TV. It was really great. So I mean, you can do
Wow.
so much harnessing the power of the mind, brain, body connection. And that's just one example.
Yeah, at first I thought you were going to say, Dr. Bob, you took him back in the 1800s and told him, here's a bullet, bite on
And that's what I call the distraction method.
Yeah.
So,
Yeah.
but there's
Exactly.
a lot to be done. Like in my case, I developed I played college football, as you guys know, and I had a lot of skied all over the world, had a lot of ski accidents. I've had 3 ACL reconstructive knee surgeries, had back and hip pain about 10 years after I stopped playing football. And it came on slowly over time, and that was really bad. And all the conventional care, there was nothing that could be done for me. They couldn't do anything physical therapy wise. And they just said, Dr. Bob, you're just going to have to, grin and bear it and wait as long as possible to get your hips replaced. And at age 40, that was like, I'm not doing that. That's crazy. So I started exploring alternative therapies, and I about 12 modalities later, and many thousands of dollars and a lot of time driving all over the Detroit metropolitan area, which where I was at Henry Ford Health System at the time, directing the Center for Integrated Wellness. I finally was able to get out of pain. It was incredible. Um, and once you get out of pain, it seems like a miracle after suffering
Yeah.
for all that time. But then I got my training. That's how I got into holistic health. And I so many practitioners, uh, uh, people who develop methodologies like Moshe Feldenkrais. I mean, he had chronic pain. He couldn't get rid of. Nobody could get rid of it for him. He basically studied the human condition, figured out and developed Feldenkrais movement reeducation technique. Thomas Hanna somatics, Alexander technique. St. John neuromuscular therapy, Paul St. John in a helicopter accident in Vietnam. These are me with my situation, having developed chronic pain there was no answers in sight. We just had to explore. So every patient out there who's got some kind of ill health issue, it requires your personal exploration. That's my message. My message is go open your mind up, go explore, ask a lot of questions. You use your discernment capabilities to evaluate what people are saying, and then bounce those ideas off other people till you get to some idea or some conclusion that you can see something that could be valuable for you. It's so important. I just call it personal responsibility for our health. We got into the mindset. I think we got programmed to. We don't have to take responsibility for our health because there's always this magic pill that can get the job done. And these pills are great. I mean, they solve this, they solve that. You look on the TV ads, you can see what a wonderful time you can have while you're experiencing all the side effects from the medicine that's addressing it's just addressing the symptom and not the
Yeah.
underlying. So personal responsibility, so important.
Right. And for me, I think was key in also just you're addressing the symptom and you're not addressing the underlying cause. To me, that always means that underlying cause has the potential to break through it sometime. It's still working in there. You're just not experiencing it.
Yeah, totally.
And so then you got the potential to still get worse. For the rheumatoid arthritis or the Graves to progress and kick through.
I,
Um,
I got a great example for you.
And then you got the opportunity for it to shorten your life, shorten your longevity. Go ahead on with your example.
What you said got me thinking about back surgeries. So, they do a fusion. They take two vertebrae and they fuse them together because there's all kinds of pain around there. And they think that if they fuse the vertebrae, that's really going to solve the problem. We know that a lot of the time those back surgeries don't work. And even if they do, they work for some shorter period of time. They don't work anymore. So when somebody gets, let's say, L4, lumbar 5 fusion, there were abnormal force vectors that were operating to degrade that joint and get that joint unstable. And when you fuse it, those abnormal forces direct elsewhere. That causes degeneration and dysfunction in L3, L4. Then they got to fuse that. There's people that got most of their spine fused or their neck, their neck is fused.
Right.
And so the thing is, you got to get at what's causing that joint to be degrading and dysfunctional to the point where the surgery is needed in the first place.
Right.
And once you start asking those questions, you can avoid a lot of surgeries, which I did for many years. I kept my hips for 25 years before I needed to get the surgery.
Right. So you've got that compounding effect on it, and that gets back over into one of Breck's world is again is you keep taking the medication, not addressing the cause. Sometimes you have to get into higher and higher and higher amounts of medication, exposing yourself to more and more potential side effects of it, one way or another. Anything else we should dive into on the medication front, Breck?
No, just again, when the side effects are outweighing what the benefit is that you're getting from the medication, and again, the majority of medications were not intended for lifetime use. They were a stair step to get you to a better place.
And again, I don't want to sound like I'm falling too far over into the Dr. Bob camp, but meaning I'm not against medication. I'll say just me personally, I think it's got its purposes. It can be of help. I have used it myself, whether they be over counter or prescriptions. Part of me for myself, when I look at it, I would be very, very hard for me to be compliant taking medication for long term. I got some those supplements I'm supposed to take, with breakfast or with food. I forget that sometimes, but it's not going to kill me if I miss those. So if I miss my medication, if things get out of control, I don't want that to happen. So, and I've noticed that over time where I've had occasions where some doctors have want to put me on something long term. Well, I've been able to avoid it. I just know that I would not be compliant. And so one of the things I like to look for other alternatives then. And then it's for long term. So if you can put me on there short term and we can talk about how I can get up past other alternatives, then great. Great on that.
Yeah, I'd agree with that. And again, there's always the exception. But for the majority of us fall into the category I fell into, and I took the easy way out. I was lazy, wanted to keep eating my spicy tacos, and didn't want to change my diet or do what was needed in order to not have to take that that PPI. That it was omeprazole was the medication, which has more side effects than just leaching calcium and bone strength. We did, I guess we should cover that there's a lot of medications that could be needed, right? Maybe even a steroid,
Right.
that do rob your body of nutrients and minerals, or they block your body from being able to absorb minerals. And so that should be noted on taking medications. Know what those side effects are going to be, blocking your body from needed minerals to make sure that you are compensating. So even if, I have a pharmacy friend that said there was one medication she would never want any of her patients to ever be on. And it was a steroid.
Mm-hmm.
And then later in life, she had all of these problems and found out that the only thing that was going to save her life really was this same steroid.
Yeah.
And so she needed to be on this particular steroid to live, but she knew so much about that medication that she knew exactly what she needed to take to offset the side effects she was going to have from mineralization, from sleep problems, insomnia, from all these different issues that she was going to have. There were 150 plus known side effects to this particular medication she had to take. And so she counteracted it. She created a couple of supplements, a morning and an evening supplement, and now sells that to patients that have to go on that same medication to sustain life.
All right, good point. Dr. Bob, you wanted to jump in?
I never heard this before. Breck said it many a year and a half ago when I first heard it from Breck, when we met, and that was that when the side effects outweigh the benefits, that's time to make a change. I think that's a really important message. What I would add to that is that when we're on a medication in the beginning, everything might seem very great, working well. Over time, though, that's what people need to be concerned about. That's why long-term meds can be problematic, because you're taking a medication long-term, very potent chemical with side effects that may not occur right away, and they may accumulate later. And we may not even associate those side effects with the starting of taking that medication. And so that leads to a medication for that symptom, as you pointed out, Breck. So just remember that, even though the side effects aren't outweighing the benefits, is taking the pharmaceutical really the way to address what the underlying source of the condition is. That's what I would add to that, Breck.
Yep.
All right. Now, before we're getting kind of short on time here. I didn't think we'd go this long today, actually. But one area that I think we've got to touch on that's just fascinating to me, and I'm still coming to accept it a little bit, which is the thing where people talked about Breck will always say another one where this is praise Breck Day a little bit, where he says, wellness, it's in you, and it is. But a lot of the way these people brought their wellness out, as you look at whether it was Lori Lundeen talking about it and how she got relaxation, whether it was Nicole LeBaron who talked about and now has her whole practice built around it, was getting out of the control of the sympathetic nervous system and getting into control of the parasympathetic nervous system. And so I always understood, yes, you had your rest and restore state, the parasympathetic. You had the sympathetic was fight or flight, and you got on that. But I can't say I always said, boy, that was a key to healing. But they were getting into that state and living in that state. So, but they say these people who have accomplished this healing, ulcerative colitis, Sjogren's syndrome, like Divya. I can't recall exactly what Michael went through, but all of those kind of put it in that case. But what do you say about this, Bob? What is this parasympathetic?
So to me, everybody's on this bandwagon now. The bandwagon is you got to live in a parasympathetic state, blah blah blah. To me, you got to learn how to interrupt the automatic stress reactions. Stress reactions are generated from the sympathetic nervous system if we have to use that model. And when we interrupt the automatic stress reactions, that allows the sympathetic nervous system to get out of the picture, and it allows the parasympathetic system to shine through. So to me, parasympathetic system is like relaxation, peace, calm, and the sympathetic nervous system is stress. So S for stress, sympathetic stress. So I don't look at it in terms of, I'll give one clue that I think is a really good one. And I don't know if this really works as physiologically works or works as a psychological placebo-like stimulation. But people say, and I teach it now, when you want to activate the parasympathetic nervous system, your inhale should be shorter than your exhale. So you inhale for 4 to 6 seconds, and then you exhale for 8 to 10 seconds. And that can really do that a few times, and that can really help a person relax and allow the parasympathetic nervous system to take over. So, but what I now do is with my clients is that I teach them how to activate their instantaneous, I call it the instant relaxation response.
A new one for Bob. That's
a new one. I was just learning your first one. Now you've got a whole. Okay, put an acronym. Make an acronym for me.
IRR, instant relaxation response. So basically, when I work with people, I teach them how to do this by counting to 3, snapping my fingers, and they take a breath of 4 to 6 in and the 8 to 10 out, and then they're just like, whoa, relaxation. Yeah.
But so aside from
guys, I'm going to do this with you guys. Ready? Okay, as soon as you hear the finger snap, just take a nice full inhale and a longer exhale. 1, 2, 3. There you go. You guys are out. Thanks for playing along with me.
I'm so relaxed. I don't know if I can finish this episode. It was amazing.
But the question becomes, Bob, as I think about it, the sympathetic nervous system, when you're into that, is you're pumping adrenaline and you could be pumping cortisol. So I can see how that could be damaging to you. But now when you trigger these things, what was this called? The instantaneous what, Bob?
Well, it's the instant relaxation response.
Instant. When you get into the instant relaxation response and you trigger that parasympathetic thing, what are you releasing? Why is that so key to healing? Aside from getting
Well,
rid of destructive things, what are the therapeutic things that come with it?
because you're instantly liberating the whole human being from the stress activated phenomena that go in the body. You
Mhm.
know, the blood pumping, the sympathetic nervous system going on, the fight or flight, the cortisol, all these things that are going on as a result of the stress response. Excess muscle contraction, dysfunctional, imbalanced muscle contraction, which causes all kinds of postural misalignments, headaches, you name it. So many things happen. And so when you go to the instant relaxation response, you're releasing nearly immediately the hold that the sympathetic nervous system has on the human being.
Right.
It's
So
just fine.
yeah,
It's what I call it's an automatic pattern interruption.
right. So you release that hold, and what are you unleashing?
Well, the parasympathetic nervous system is always working in the background. So, I mean,
Yeah.
so the parasympathetic nervous system is going to keep working. So it can go back to supporting really good digestion, which wasn't supported when the sympathetic nervous system or the stress was activated. So you can get really good digestion. You can, relax and release the muscles, the skeletal muscles, which are in contraction when we go into stress and fight or flight. And then blood flow is better. Blood flow improves, much like the pulse electromagnetic therapy.
And this is really working for your patients. I can tell because I haven't seen you this excited about a topic, Dr. Bob, in some time.
Yeah, I just created this thing because I see I need something. I need the people to, first of all, because the way I work is I work quickly. I want things to happen rapidly. I don't want to take like weeks and months and
Yeah.
see people all over and over again. That's the last thing I want to do. If I can't help somebody in 1, 2 to 4 sessions, it's not working. I know in the first session, and I'll know in the first session if I can help them. But I'm always looking for ways to accelerate the healing process. So that's why I said that's why I can take somebody on the first meeting with me. I can do it over the internet, which I have
Yeah.
my practice. I can show them how to do this, and it works. If they do get into bed and do that one, they just go and I tell them they don't need to do the count to three and snap. They just have the intention and take the breath
I
and
want to visualize three sheep when I lay down in bed, three sheep and then snap.
they're all snapping their fingers.
So,
Yeah.
so the breath, so the breath work helps in getting into that mode. One thing I was having a dialogue with the doctor just the other day, and we were talking about PEMF, like all three of us use, and his hypothesis as well, that looked at and makes sense, was that the PEMF, while it doesn't work directly on the parasympathetic nervous system, what it does do is it works on the sympathetic and to the same point can relax you from that, get you out of that. And once you get out of that, just as you talked about, and then with this added pump, you can increase the blood flow, you increase the microcirculation, and that has tremendous healing benefits as well. So the breath work, the PEMF, meditation that people have found, these people have gone to, I think,
Muscle release,
yes,
Mm-hmm.
yep,
Yep.
contraction, and all the thoughts, everything else. I mean, think the thoughts, the actions drive results. So if stress comes on, there's an action that drives results. It affects the stress affects the skeletal muscle tension. It affects the way we think about things. And when we interrupt that, the thoughts change.
right,
So
yes,
just by laying on a PEMF mat, thankfully they have evidence for the fact that the microcirculation is
right,
sped up, which is beautiful. You get more oxygenation of tissues, which is really important,
Yeah.
more removal of toxins, which is really important. So, and the benefits I got from the PEMF mat was phenomenal, which I did not expect.
Yeah. Same. I had, nerve damage from, all of that surgery in the ankle and repairing and putting, foreign objects in there. It interrupted the nerves in my foot. Couldn't even feel the top of my foot, and PMF corrected that as well.
right. And I'll tell you, Carrie Mancarini, who was one of our wellness heroes that we've alluded to here, runs the IV therapy out there in California and also helps people nationally. She just upgraded her PM after a couple of weeks back, and she said she got additional, even with all that she does, and has helped her. And Doctor said Dr. Bob helped her with some things as well here. Is that PEMF change? She felt a change in one day with that. So that's why, to Bob's point, I like that instantaneous quick help as well. So she knows that.
Yeah.
Up.
And so just for me to finish up today, I just want to say that for people who are going out there trying to figure out how to relieve symptoms without drugs, you really got to examine the involvement of stress. And you've got if you're working with any kind of practitioner, doctor, physical therapist, alternative medicine practitioner, functional medicine doctor, and they're not addressing stress with you, you either got to find somebody who will work with you in conjunction with them or find somebody else. You've got to be working on the stress factor. We know that stress is involved with more than 75% of all physician visits. It's an underlying factor in nearly all ill health conditions. So make sure you're working on while you're working on everything else and all the different things we're suggesting you do. Also work on interrupting the automatic stress reactions that nearly everybody has. Thanks
Yeah.
for listening.
Yeah. Well, Tim, did you have anything else you wanted to cover on, on the nervous system before moving on to? I'm looking forward to this next segment, so I'm getting anxious.
No, go right ahead, Bob.
Okay,
Go
so
right ahead, Bob. So, thinking you like Bob now, you're getting anxious.
yeah, I am. I'm getting anxious because bringing it back to our wellness heroes that we interviewed over, these last mini episodes. One of the things that inspired me the most was that they didn't just stop when they were able to get relief themselves and heal themselves and get off of the medications and completely be well again. But the bigger picture was that they wanted to help others do the same thing. So that's what I wanted to turn our attention to, is that, turning their own healing into a purpose. So, going back and looking at, what Lori Landing, talked about, she quote, I knew I could come through this, and now I wanted to help others find their way too. And that's back in episode 20 of this season 2 here. And then Carrie talks about healing wasn't the end of the journey for her. It was the beginning of a mission. And so I wanted to jump into that because there was so much that we learned from these wellness heroes and taking it to the next level to help others. So what are your thoughts on that, Tim or Dr. Bob?
Well, I'll jump in first and just say that that's how I got into holistic health and healing, is because I had to find my own answers. I had to take responsibility for my own health, and I had to go out and get treated by so many different people and evaluate them, and just been not knowing what they do, but just experiencing what I experienced and finally getting out of pain. It's like, wow, at that point, that time there were over 100 million people in the United States with chronic pain all the time. I said, God, I'm now free of pain after, this 6 or 9 months of suffering with this, pain that I had. I got to do something about it. And I think there's so many people like the wellness heroes that we've had on our podcast. That's how they all got into it. We all had to figure out answers, and then we bring the answers to other people because we want to help. Yeah.
Right. And I would just say I'm glad they did it, and I'm glad they do, because as we talked about here, and I always want to stay respectful of doctors. I admire their training, admire their going through, and some of my best friends are doctors, and I work, but they don't have all the answers. And so I'm glad these people who have found the answers, who might not be doctors, but and keep themselves in check in that regard, but they're there to complement and to help and to guide and to bring awareness to things to complement what we get from our standard MDs to help everybody heal. So I'm glad they undertake it. I'm glad they have that give back, and I'm glad they were motivated to do so.
Yeah.
So many disciplines have been started by individuals, as I talked about earlier in the program, started by individuals who had to heal themselves because there were no answers. And we're talking a lot of the, St. John neuromuscular therapy developed by Paul St. John, Moshe Feldenkrais developed the Feldenkrais movement education, Thomas Hanna with Hanna somatics. This is like 25, 30 years ago. There was nothing going on back then. And, for these people to develop these techniques and really put it out there, it took a lot from these people. So, and all of us have been building ourselves up on the shoulders of those great people.
Well, so the key takeaways, for today are, what are the next steps? So for anyone that's listening, what does it take to heal? Dr. Bob, you gave some amazing examples, of what it takes, our wellness heroes. I encourage everybody to go back and listen to those earlier episodes because there's so many amazing stories, and not just stories, but solutions that were built in. We were able to pull out through that interview process. Is there any one specific example that comes to mind for either one of you?
To me, responsibility and stress interruption, along with everything else we've talked about, because it's all important. There's not any one thing necessarily that's going to get the job done. So people taking responsibility, and as you guys pointed out, staying in it for the long haul, open the mind up, keep it going. So there's some of the takeaways.
Yeah.
Taking away.
Yes. Excellent. So much that we can learn. And so what a great discussion today, gentlemen. It's always a pleasure to be with you. I always learn so much from you and from you both. And you have so much knowledge to share along with our wellness heroes, and they're sharing what they've been able to do. So I encourage all of our listeners, again, go back, listen to the full episodes of Jeff Pearson and McCall and Lori and Carrie and Divya. We'll leave the links in the show notes here of what, season 2, episode 10, 17, episode 20, 21, 25, all great wellness hero stories that we encourage you to go back and listen to.
Right.
And
thank you, Breck, for going back. You went back and you investigated all those and you pulled it out. That's fantastic.
that was our executive producer, Tim Daniels.
Oh, Tim,
Yeah.
Tim, fantastic.
Yep. Yeah, amazing job. I said this was brilliant when we talked about putting this episode together, because it is so much good information that not everyone has heard, and so we encourage people to go. Another great resource for our listeners is please join the WellWaveNOW group on Facebook, the Facebook group. There's so many resources there, and we encourage you to join that group. Visit and subscribe to the Wellness Wave Club on YouTube. We'll leave that link in the show notes, and then, share this episode with someone that is, dealing with the challenge, that they'll find some help through all of these. That's why we do this. We do this to help as many people as we can, to bring wellness solutions to as many people as we possibly can. So thank you again, gentlemen. And until next time, stay curious, stay empowered, and remember, wellness, it's in you.